That's fascinating. Um, it sounds like you work with just a very wide range of different people who have different abilities, different competencies. Um, can you talk a little bit about jobs that might be available at Jounce? You know, if not right now, at this moment, just in general at the entry level. For somebody who's just a very recent college graduate, what kind of thing could they get into in clinical research?
Yeah, in my department, starting with my department, we have a role called a clinical trial associate, and that individual supports the clinical trial manager, helping with, like I said, the planning and execution of clinical trials. There's a lot that we do to ensure that we're following the regulations and we're documenting that we're following the regulations. So having some support, um, for the clinical trial manager is essential. So as part of that, so even though early on it's a support role, then over time, one is learning what's necessary to conduct clinical trials, and then we'll get increasing responsibilities. Like I said, when I joined, um, in my very first position was entry level, I really didn't know anything, and I really took the initiative to try to learn as much as I could about the industry and always raised my hand um, to take on new responsibilities. And when I did take them, I worked really hard to and try to do them well. And then over time, you hope you get recognized for all that, for all the good work and accomplishments, and then get positions of increasing responsibility.
That's certainly good advice for anybody, no matter what career they're entering. Um, Great. Do you have particular part of your job that you really enjoy?
Yeah, as I mentioned earlier, it's inspiring to be able to work on these new therapies. I've always been in a position working on new novel therapies. So I'm in cancer therapy now. My first job was developing a bone growth um, um, protein
Mhm.
to replace people who are missing bone or lose bone due to trauma. I've worked on antibiotics. I've worked on hepatitis C drugs. So I've really had the fortune of working on some innovative drugs. So that in and of itself is very inspiring to be able to
Mhm.
either save lives or improve the quality of life for people. And that's been rewarding. So that's at the highest level, that's one part of it, because you're the eventual people you're you're doing this work for are the patients.
Right.
But as part of the job, I've always been surrounded with some very motivated, smart people who just like doing the work, and it's very inspiring to work in that what we call a matrix environment, really working hand in hand with other people who have the same goals, underlying goals of wanting to improve society in terms of saving lives or improving quality of life. So we're all together, working together, with that same goal in mind. So that's very motivational as well too.
Certainly, I would agree with that. Um, do you have any particular advice for students who might be in high school or college now, or even graduate school, who are really unfamiliar until now about careers in clinical research? What are the particular skills? What's a really actionable piece of advice that they could take to heart, whether it's a particular class you would recommend, or learning a particular skill?
Yeah, well, I'm obviously biased toward the life sciences.
Mhm.
But if you look at all the offerings under the category of all the STEM programs,
Mhm.
that's a good area to spend some time and learn all about the different offerings within the STEM programs.
Mhm.
There are statistics now that the STEM, at least the U.S. Trained STEM graduates are underserved right now. So there's a big opportunity to really make a difference if you pursue a degree in one of the STEM programs.
Mhm.
But in terms of just some basic courses, basic biology, because you learn about plants, it'll help you with gardening. And if you advance in biology, it's the foundation for pursuing some specialties within the field of
Mhm.
biology.
Definitely. If for somebody who has said, okay, I'm going to graduate from college and I'm going to try to become a clinical trial associate, um, would you recommend, for example, taking additional chemistry classes or taking a course in statistics or maybe a class in computer programming or a class in writing?
Yeah. Well, all of the above is useful in my job and for the people in my department. My advice would be pursue something that you're really passionate about, not just ticking a checkbox, but really pursue something you're passionate about. So when you do invest your time in pursuing that class or that career that you really want to do well in it and learn from it, because they'll all help in the future. But in my field, certainly having some exposure and background in biology is really helpful.
Yeah.
You don't have to be, even though you may not be in the lab driving the experiments, it's important to understand the science, to understand how the drug works, how it may affect the body, how the body is affected by the drug, and it's really important to be able to have those conversations with the medical physicians, with the PhD physicians, with the doctors and investigators who are treating our patients. So in order to have that conversation, having some biology or science background is really, really helpful.
Excellent. Great. Um, this has been wonderful and so informational. Do you have any parting bits of wisdom that you can send to these students?
Well, I said it earlier. I think whatever, try to follow your passion, but whatever you do commit to, try to do it well. Work really hard. That's hopefully, been one of my pillars in life is just, to work hard. And certainly in the field of biotechnology, there's lots of opportunities. So I was always one to raise my hand and take on a new opportunity, even though I didn't know much about it, but I would take the initiative and do some research and try to do well at it. So take advantage of all the different opportunities that are offered. And what I tell people in my department, especially those who are just starting their career, if you see an opportunity, bring it up and then go for it. And I love to be surrounded by people who are driven, are self-starters, and take on that initiative. Just to get better. Because at the end of the day, if everybody's doing their best, then as a whole, the team will be that much more successful.
It sounds great. Sounds like you'd be a great manager to work for.
No, I love it. While managing, what I do now is managing departments and managing people. So I've really enjoyed that part of it, and hope to build. My legacy will be, building, future leaders, in the field.
Excellent. Well, thank you for sharing your time with us today, Manny. This has been a wonderful interview.
Yeah, it was an honor and privilege to be part of it, Carla.
Thanks. Take care.
Okay.